That's great. So without further ado, let's get going with our panel today. I think it's going to be a wonderful discussion. And so I invite to the spotlight, I guess, Beth Timmers, the Acting Vice Chair of Food Matters Manitoba. Beth's an environmental social scientist and project manager with the International Institute for Sustainable Development, with 10 years experience researching food and agricultural sustainability, and also someone who grew up on a small scale farm in Southwest Manitoba. So probably passionate about this work in a few different ways. So I give it over to you. Thanks so much for being here, Beth.
Wonderful. Sarah, thank you so much for the warm introduction. This is my first CCEDNet gathering coming from out of province about a year ago. So it's your introduction just set such a warm and wonderful tone for this panel discussion. And I really commend CCEDNet on your accessibility options. It's really wonderful to see. So this discussion panel today is organized jointly between CCEDNet and Food Matters Manitoba. I'm so excited to be moderating this panel today. And today we're going to be talking about food. We're also going to be talking about power, but sort of those two things intertwined. So data shows that the pandemic has very much exacerbated existing rates of food insecurity across Manitoba. We've seen that government and also community responses have largely and to an extent understandably focused on emergency food relief. However, this problem that we're seeing of insufficient and inadequate food that's being exacerbated during the pandemic is not necessarily about a lack of food, but rather a problem of inequitable economic access. So the goal of the panel today is to gain a deeper understanding of the food security experience across Manitoba, and also to collaborate to shift this community response from a charity focus to an advocacy-driven, equity-based strategy. So I'm so pleased to just quickly introduce our panelists today. Then I'm going to give a little bit of background on what the panel is going to look like. So first, I want to introduce Kirsten Bernass, who's the Director of Housing at the West Central Women's Resource Center. She's also the chair of the Provincial Working Group of the Right to Housing Coalition and sits on the steering committee for Make Poverty History Manitoba. Hi, Kirsten. Good morning. Next, we have Megan Urbas from Harvest Manitoba and Basic Income Manitoba. Megan is the Advocacy and Impact Manager at Harvest. Congrats on the new name. In her role, she's a community advocate, is also a liaison with all levels of government, and does community-based research. Good morning, Megan, and thank you for being here today. Next, we have Damien Lorenchuk from Fox Lake Cree Nation. Damien is the Northern Food Coordinator at Food Matters Manitoba. He's driven by the Inanwook or Swampy Cree teachings to provide for his community at Fox Lake. He learns all he can from the land and his elders. And now with Food Matters Manitoba, Damien is focused on helping other communities share their knowledge with youth. Hi, Damien. Thanks for being here today. So today we have a very interactive panel discussion, really focusing on the expertise of our panelists. We have a few interactive components. We're going to start with a trivia question. Then we're going to open our discussion with one question. We're also going to show a short video after the first question, and then we have a bit of more discussion and then opportunity for some audience involvement. So first, we're going to start with some trivia. If we can pull up the trivia onto the screen. Okay, great. So according to Proof's research on food insecurity, back in 2017-2018, 10.9% of Canadian households reported not having enough access to food. With the pandemic in May 2020, this percentage has increased to, and you have three options there. The first is 11.3%, the second is 12.1%, and the third is 14.6%. Okay, so we're going to reveal that answer in a few minutes. And just to give everybody a heads up that there will be a Q&A session at the end of this discussion. So if you have questions or comments for our panelists, you can write them in the chat. We're going to be monitoring that, not me specifically, but with some help in the background. And we're going to read your input during the Q&A. If you would like, you'll also be given the opportunity to ask your question yourself, as Sarah mentioned, but I want to get started on this discussion today. I'm so excited to kind of dig deeply into some of these pressing issues. So the first question today is that we hear a lot of experts saying that the COVID-19 pandemic is exposing or perhaps magnifying some of the cracks that already existed in the food system. So for our panelists, and I'd like to start with Damien today, thinking back to a year ago in the work that you do, what were the food security challenges that you were already witnessing in your work, in your community? And then next question, for better or worse, how were these challenges being addressed?
Thank you. So speaking from the context of the Indigenous communities in northern Manitoba, the biggest challenges that historically and continually that we face are dealing with a very long experience of systematic destruction of our communities, and the absence of value that's given to us within the greater Canadian society. So, we look at our communities as remote, as isolated, and very strongly dealing with food insecurity. But all of these are new problems, and all of these are Canadian creations given to us. When our people were connected in every way with the relations around us, with the animals, with the land, the waters, there was no such thing as isolation or remoteness. We were exactly where we needed to be. So, for over 100 years, hundreds of years in some areas, these relations, these connections, these knowledge, it's all been, there's been huge investments undergone to take all that away, to destroy all that. So, we sit in the place of such prosperity, food all around us, everything we need, but we've lost that connection and that understanding of how to make the most out of everything that we have. So one example of the absence of value that we have in Canadian society is a lot of Canadian entities will spend millions, even billions of dollars to come up into our areas and to harvest all of our resources, and in doing so, destroy the land and its ability to provide for us. But when it comes time to feeding our people, there always has to be a huge debate and rationalization on how can we as a society permit spending money on helping these people in the north when they need to pull themselves up by their bootstraps and feed themselves. So there's a huge double standard there that our people are faced with, and now we have these problems of remoteness because having lost those connections to everything around us, we rely on the food systems of the south that are so reluctant to help us in an efficient and a good way. So that's a huge part of the challenges that we face. And the second part was what has been done. So for better or for worse, so both sides of the actions that have been taken is, there's a lot of great organizations that do a lot to support us in our communities. They find funding, and these get us equipment, these get us operating costs for programs that connect the youth and the elders, and help to bridge the loss of knowledge and understanding and skills that are required to harvest from the land around us. But unfortunately, a lot of these programs and a lot of these supports, they're insufficient for with respect to the scope of the problems that we face. There's a lot of inconsistencies in the support. And one of the biggest problems is, in the context of these initiatives and programs, all too often our people are viewed as some sort of incapable community that needs to be saved from the outside. So, but on a positive note, there are a lot of organizations who really understand that and understand the value of relationships and empowering the people on the ground. Thank you.
Thanks so much, Damien. I think some of the issues that you brought up really help set the tone for this panel to get sort of beyond the symptomatic issues of inequality and long history of colonization to address some of the more structural pieces. So Kirsten, did you want to go next addressing some of these issues?
Yeah, sure. So I'm going to speak from what I see and what I've been seeing at West Central Women's Resource Center, because I've been there, I guess it's 3 or 4 years now. And so we, for those of you who aren't familiar with this center, operate a drop-in space for women where they can come in to access their basic needs, and offer other programming in areas around housing and mentorship, settlement, for example. So in terms of food security challenges that we see, I mean, the main problem is that people just don't have enough money to buy food for themselves and for their families. And you know, the women that we see that come into our center, many of them are housed and relying on employment and income assistance, but we also work with a lot of women who are experiencing homelessness. They may not be on any sort of income assistance program, and so they have zero income, and you know, they're looking for basically free food options in our community at organizations like ours. So it can be very challenging for people to get onto EIA. So there's some system issues there that make it really difficult for people to even access the income systems that we have in place that put them in any kind of position to be able to purchase food. And so that's something that we can help people with, is getting onto employment and income assistance. Another area where that becomes challenging is, for example, when you're exiting systems. Like, we've worked with some women who are coming out of incarceration, and they exit without access to any kind of income. There's systemic challenges there that prevent people from getting onto an employment and income assistance file prior to release from jail. And so they are out without any income to find a place to live and obviously access food or any of their other basic needs. But most of the women that we are working with are on income assistance, and that's their main source of income. And the rates are just simply too low for them to be able to meet their basic needs. So they get a certain budget to pay for their rent. Housing is usually the biggest expense. That amount has increased in recent years, but it's still just woefully inadequate to find a place in the private market. So our housing programs at the center help women with that. They get $576 to pay for their rent. An average one bedroom costs about $950. So you know, they're really pulling from the rest of the budget they get from EIA, which is $195 to pay for their rent. And so that leaves them with very, very little to buy food or any of their other basic needs. And honestly, for a lot of those women, purchasing food to kind of take home and prepare isn't even really a great option often, because they don't have the resources to purchase things they need to prepare food. So often they do anyways rely on agencies like ours that have meal programs where they can come and have something like ready-made to eat, and then, you know, also meet their other basic needs, because their budget is not enough to pay for things like, you know, doing their laundry or purchasing hygiene or having a phone, or getting winter gear, right? So they depend on agencies like ours for that. So, I mean, in terms of how the challenges are being addressed, I think that, like, community organizations are applying for funding for meal programs and other resources that can be provided to help people meet their basic needs. We're asking for, you know, more donations from people and from businesses and organizations. We are operating housing programs. We're trying to, you know, help people apply for social housing where rents are really low. They're geared to people's income, and that makes housing a little bit more affordable, and so frees up some income to pay for food and other basic needs. Wait lists are super long and have been for a very long time for social housing. So we mostly have to try to look for housing in the private market. And so we do try to build relationships with landlords that are, you know, providing rents, like very low rents, but there's very few of them out there, and it's a really huge challenge. We also apply for funding for rent top-ups. So one of my housing programs, the women who get that $576 for rent, we can top that up to $200. So we can look for a place for $776. That's money they don't have to pull from their basic needs budget to help them pay for food and other things. But I think some of the more transformative things that are being done to address the challenges, right? Like those kinds of things, we're trying to just sort of plug holes and sort of meet the immediate need for like food and housing. But, you know, I think that work, that kind of transformative work is happening through a lot of the coalition work that we see in our communities. So Make Poverty History, Right to Housing, calling for more things like more social housing, so people can afford the housing they live in and free up more of their income to meet their needs for food and other basic needs. Calling for higher EIA rates. I said we had that increase to the rent budget in recent years, but the basic needs amount of $195 a month for food and clothing and hygiene and phone and transportation, it's really seen no increase in more than 20 years, I think. It's a very tiny increase. It's certainly nowhere near enough. So that coalition work, the work that the EIA Advocacy Network has done in the past to solve some of the more like bureaucratic issues that prevent people from, you know, accessing their income support benefits from the provincial government, that's been transformative in some ways. So yeah, I think there's, you know, that sort of two levels of work happening to address the issues. There's sort of, we need to change what's happening at this higher level that's preventing people from having the incomes that they need to purchase food and their basic needs. But until that happens, we need to also find ways to meet those immediate, very urgent needs. I'll leave it at that.
Great, thanks, Kirsten. Yeah, I think it's, again, indicative of this sort of immediate issue and then the long-term structural issues that are happening. So I'm really interested to hear, Megan, your perspective also from Harvest Manitoba, if you're seeing a similar sort of multi-level issue that's going on based on your experiences there.
Can you hear me?
Yes.
Okay, good. Hi, everyone. For those of you, and I'll talk like sort of what Kirsten said, sort of just from the experience of Harvest to begin with. So Harvest Manitoba, previously Winnipeg Harvest, is a not-for-profit community-based organization that shares food with a network of 350 community organizations across Manitoba. And prior to the pandemic, we were already sharing food with 70,000 people per month, with nearly half being children. So our networks and agencies, those 350, consist of, sorry about that, food banks, schools, daycares, other community-based organizations. However, our food banks consist of about half of those 350 agencies, and are a place where folks can access a community food bank hamper. So you can go into the community, you can access a hamper, which is meant to support and supplement income or food that folks already have. And prior to COVID, you were able to access food every 2 weeks. However, we know that prior to the pandemic, what food people were already receiving was probably what was the amount of food that they would have for the entire time for those 2 weeks. So for example, if they received a hamper that had sort of like rice and peas and whatever the other items they were, that would be what they had to have for the next 2 weeks. So I'm already knowing there were like a lot of restrictions to food bank hampers that people were already receiving. So I'm also reading from some notes. So from an income perspective, our community was already telling us that the reasons why they needed to require our services was because they were unable to make ends meet. So again, just highlighting what Kirsten was saying around EIA, many individuals were saying that the primary source of their income, or are saying, I should say, their primary source of their income is EIA, so Employment Income Assistance, and EIA disability. And for a number of reasons, saying, you know, citing challenges to being able to find employment. So Beth, you didn't mention for better or for worse, but I'm just going to kick right into that. So for better or for worse, or how are these challenges being addressed? The prior to COVID, we were an organization that was open to the community, like many other community organizations that are watching today. We were a safe place for people to go, a community-based organization where people could get in-person services like job training, job readiness programs, gardening, food education, eating. So people could come and you could volunteer and you could have breakfast and lunch, see a friend, have some coffee. Our client services department was open to the public. So for your first visit, when possible, people would come in. They were able to, our client services department then were able to share with people what they could expect when they were going to their first food bank appointment. And for some, that connection to the building or being able to sort of see a food bank in the way in which it operated sort of made it easier, calmed their nerves, and then often, made it easier for people to be able to continue to ask for help as they needed it. Previous to COVID, we were able to offer a distribution method that met the community's needs. As I mentioned, every 2 weeks. Some would have a shopping method where people would pick items, or you could go to a food bank and there would be hospitality options. So low cost grocery store, coffee and tea, an opportunity for people to share resources, inclusion, getting out. And then of course, connecting with our community from an advocacy perspective. So being able to have those conversations, working with each other to find ways to be involved and get involved in different initiatives and sort of rally around the barriers that our community or communities are saying they're experiencing, especially around food insecurity. So prior to COVID, there was this community cohesion. I still believe it's there. It was just, I feel, way more aggressive in a safe, positive way, of course, but definitely more accessible.
Great. Thank you so much, Megan. So I think that gives a really comprehensive picture of sort of the way things were going pre-pandemic and the ways of working and the coalitions that were already happening, and sort of some of the immediate actions that were happening, but also some of that transformative work that has been starting to emerge. So we just want to pause the discussion here and share a video from Food Matters. And Food Matters recorded this about a year ago pre-COVID. And the people who were involved in the video were asked to talk about their experiences around food insecurity and then some of the solutions. So we're going to quickly show this video and then move into the sort of post start of COVID phase and talk about that a little bit.
There's a hierarchy of needs that every human being needs, food being one of the very basic ones. And if those initial needs aren't met, then that person or community are unable to move towards the next needs in the level.
Access to healthy food is a human right. It's enshrined in the UN Declaration of Human Rights. It's a right that Canada has adopted as an aspirational right, is the right to food. So it's about the ability to be able to purchase food or to have access to the resources to produce your own food, so that it's a dignified right.
I believe that Manitobans can help food insecurity by helping at their local food banks, by helping at a soup kitchen, and take away the stigma of people that are suffering from food insecurity.
At a community level, access to healthy food then is also about thinking about what are all the resources at a community level that could support people in provisioning and accessing healthy food. So it could be grocery stores, it could be farmers markets, community gardens.
Rainbow Community Gardens, for example, which is a grassroots initiative. Each of the families was saving at least $100 on groceries every month.
I would love people have more accessible to garden around Winnipeg. A lot of the very successful programs are the ones that are community grown and community owned.
I run a lot of programming, like after school programming, where I feed the kids, right? So then I come do a big shop here in Winnipeg, and then I just keep the food back home. But I can't buy a bunch of fruit and keep them for the month. My dream is to start our own greenhouses. That way we can create our own vegetables and share with the communities around us.
If we're thinking outside of cities, it's about also access to land and territory to go and provision wild foods and to hunt.
For thousands of years, we ran our own communities, our own societies in a way that allowed us to be some of the healthiest people in the world. The only time that wasn't the case was when we were colonially ruled by Canada. So I think by removing that and allowing us to control our own societies again, I think that would definitely give us the space to improve food insecurity.
To listen to communities and make sure their voice is heard and make sure that they have the resources, not only financially, but also the human resources and the training in order to make sure that their own solution come to life.
In terms of enhancing food security and thinking about policy and systems change, this isn't only about what foods are being produced or what we eat, but also how are decisions made about the food system. And so, the Winnipeg Food Council, the Brandon Food Council, they're examples of this rise in citizen and civil society interest in food. It's really important to think about the way in which food interconnects with all sorts of other systems. So we need to be thinking about the interconnections among agriculture and health and trade and environment. And so addressing food security is very much about thinking about supportive income policies, about addressing housing, about addressing transportation needs.
Being able to provide kids nutrients and a safe place to eat is an investment in our future.
There's a space in our society where people don't get treated with dignity, and I think we can move that needle together, and that starts with people who are food secure and don't live in poverty, looking at themselves and what they can do for someone who is, and reaching out to help, or just treating them better, right? Treating your neighbors as you'd want to be treated.
All right, so as I mentioned before, this was recorded about a year ago and a lot has changed. So now we want to move the discussion into sort of the new normal that we're facing today. And I just want to start by commending all the work that our panelists and their respective organizations have done to pivot their work to address the pandemic. I'm sure you've all been working so hard to deal with the unprecedented situation that we're in now. So in this context, we've seen a huge investment from the federal government in income, domestic food relief for frontline agencies who are facing huge demand for emergency services related to food security. So for this question, I do want to start with Megan and get that sort of frontline food perspective based on your work at Harvest Manitoba. So reflecting on your answers to the first questions and on some of the statements that are shared in the video, how has your response changed at work? What are you maybe doing differently? What's been happening? And what do you see out there in your work that's different now?
Yeah, so Harvest really had to pivot and change our services. We essentially had to close our building to the public, to the community in many ways. But first and foremost, we were, we're ensuring right now that people who are struggling can receive food as soon as possible, but also trying to continue our work towards improving social safety nets, better income supports, so that we can, prevent more people from falling into poverty. In the beginning months, we saw a 30% increase in demand and then a 60% decrease in food donations. There was also a decrease in volunteering, with some food banks having to close, with folks feeling vulnerable and needing to protect themselves. So completely understandable, but just sort of, recognizing the reliance on the people power that help us do our work. We shifted our model to a larger monthly food bank hamper to accommodate increased clients. And then switched from that bi-weekly, so receiving food support every 2 weeks, to monthly, and recognizing the challenges in that. So although it's bigger, it's heavier, there's more, but that creates a lot of challenges for folks. And then we switched our distribution method to pre-boxed. So because we need to be able to accommodate for people to be able to socially distance at food banks, then we had to create this sort of pre-box method where people, we pack the items for them. So in terms of organizational support from the federal government, we received funds through Food Banks Canada, and then we began purchasing food. So that's something that we normally would not have done, other than a few different programs, our Breakfast to Go program and baby formula. But because we saw food decrease and sort of a disruption to the supply chain, we weren't able to get the same donations that we were receiving before through reclamation and third-party events and so on. So because we were able to purchase food, we were able to support some local producers. So we did that. And then we were able to purchase more sort of higher quality items that maybe are more consistent. So ensuring that there was always, like a protein, so like chicken breast and that type of thing, eggs, and so on, that maybe it would have been not something we would be able to add. In terms of reaching our community voices, our change makers, we had to adapt our engagement methods. We launched our Harvest Voices survey. It's a client-based survey where we're asking folks what's going on in their lives, where do they want to see change, what else do they want for us, what do they need from us, what can we do for them. And originally it was supposed to be in the field surveying. So we were going out to the food banks, we're talking to people, gathering all those fantastic stories and hearing from folks, but we had to change that. So we started doing our surveying over the phone, doing it over online, and then paper surveys when we had to. But with codes changing and so on, we were able to have folks come back into the building, and we were able to start seeing more community back face to face. So what else do we see out there that's different? So one thing that happened was income started to flow. Food bank numbers plateaued, which was because of the temporary benefits like CERB, which was easily accessible, was a direct benefit to people. There was top-ups to the CCB, GST, GIS, rent freeze, mortgage deferrals, etc. And then, of course, then there was the community collaboration, which was absolutely exceptional. It always was exceptional, but even more so during these crazy times. Several organizations helped us, and we helped them. We talked to one another about navigating the changes, the changing times, the changing codes, how we can better support our staff, our teams, our volunteers. Our friends in the community provided immediate food support in incredibly innovative ways. And then there was momentum. I think that we haven't stopped. We won't stop. I think although some of us are tired, I had a conversation just recently of we spent 15 minutes talking about how we were all so drained, but we're still trying to find ways to seize the moment, to sign that petition, to write the open letter, to advocate for all that we feel is important. And then, it might look different, but it's still there. One thing that I most definitely want to note is that still, like, so many folks fell through the cracks, excuse me, especially those accessing EIA. So folks are like the folks that were already making less than $1,000 a month or $10,000 a year weren't able to access a lot of the benefits that I just spoke to that did seem to make a difference in the plateauing of our food bank numbers. So still so much work to do, but yeah, just wanted to note that.
Okay, great. Thank you so much, Megan. Damien, especially because, I mean, you're in the video that we showed. And so I wonder if looking back on the comments you made on it, things have changed. So same question to you. How has your response to food insecurity changed? What have you been doing differently in your work? And what have you seen out there that's different?
In terms of the response for the questions in the videos, I don't think anything really changes there. It's the same principles that will always be constant. But in terms of the work that we do and changes made, you know, following those same principles that guide us, there's quite a bit of changes. You know, we have intensive partnerships with 13 communities around Manitoba's north. And less intensive partnerships with additional communities. So there's so many different scenarios that we have to adapt to and deal with and find a way to provide the most meaningful support. Each of those communities is affected differently, some similarly, but each has their own different experience with this pandemic and their own different ways of trying to deal with it and support their own community members, protect their community members. So prior to the pandemic, you know, we always try and support these communities through every angle that's possible to have the most meaningful impacts and outcomes. So that involved, for the most part, it's seasonally driven. So whatever the seasons allow us to do, as has always historically been, is the same way that the communities are engaging and the same way that we support them now. So that covers everything from, you know, all the different kinds of hunting, supporting goose hunts, moose hunts, caribou hunts, deer hunts, depending on where the community is, fishing, whether on open water or ice, harvesting medicine, harvesting plants to eat, harvesting berries, gardening, greenhouses, raising chickens, you know, all those kind of things. And a big part of the support was facilitating gatherings and helping support gatherings that communities would do, to do a lot of outdoor camps for land-based education, whether it's, you know, hunting camps, fishing camps, cultural ceremonies, you know, trying to support all those different things to really repair the whole, you know, the whole picture. And one of the best parts about the gatherings and the camps is that this is the opportunity that we had to really connect the communities, connect leaders, not, you know, chief and councils, but leaders on the ground leading this amazing food work, connect them with each other. And that was, you know, a really invaluable opportunity for people to learn from each other, but also to motivate each other, you know, to share the challenges, share the successes, see from new perspectives that similar problems are being, you know, taken on and addressed. So, you know, with the pandemic, it's made things very, very difficult. We've been lucky in a few places earlier on in the pandemic. We've, you know, when the whole north was closed, some communities were still able to engage in a much smaller level of gatherings and food camps, youth camps, all that kind of stuff. But it's been a huge challenge having any sort of group harvests, and you know, that's a huge part of our communities. There's a very strong emphasis on relations and connections and the whole communal aspect of it. So we've had to find new approaches on how do we get the food to where it's needed, to the homes. But how do we do this in a way that's safe, given, also historically it's very well known how our people have been affected by pandemics in the past, and as crazy as this is, we're lucky the mortality rates aren't anywhere near the smallpox that ravaged our communities. So in that sense, we're really lucky, but still, to keep our people safe from the effects of this pandemic, our approach has shifted more to supporting smaller family groups to go out and harvest, whether that's individual gardens, taking away a little more from community gardens and greenhouses, individual family outings, so empowering families with what they need to get out on the land and harvest for themselves, and share that harvest instead of going out with large groups of people and teaching many different youth. A lot of our funding as well has been repurposed from gatherings and larger communal events to we've been using this as an opportunity to really stockpile a lot or just get a lot of equipment that the communities need. One of the challenges there, though, is it's been difficult before the pandemic to source the equipment that we need and get it out to the communities, given their remoteness, their location on the fringes of Canadian society. It always is a huge challenge getting anything to those communities. So now with the pandemic, with the huge strain on these systems already, one example is we bought fishing nets in April for communities, and I was able to grab some of the last nets that were in stock in this very rare supplier, and we put orders in for nets right away for additional communities, and we didn't receive those nets until about late August, early September. So that gives an idea of just how hard it is to get this essential equipment to where it's needed, so our people can get that food. Great.
Thank you so much, Damien, for sharing. And I see there's a lot of comments coming in the chat from your remarks. And it's really interesting to hear some of the particularities about how, while your approach has changed, the underlying issues that you're facing have not. Mm-hmm. So Kirsten, I want to turn it over to you to just wrap up this part of the discussion. And same question for you, how's it going since the pandemic has started?
Yeah, I mean, I think our main approaches of like being a service provider hasn't really changed, right? We're still doing that sort of frontline, like basic needs provision, like charitable work, really. And we're doing that social justice transformative work of like trying to change systems and like what is happening at a public policy level in the first place to make it so that we have to take this charitable approach as well. So we're continuing to do that, but it's obviously changed a little bit. We've always kind of had the budgets to be able to do this work to some degree, but there is quite a bit of new primarily federal funding coming in right now that's allowing us to do quite a bit more. So with sort of that charitable work, I mean, our drop-in center has closed where women could come in the past to meet their basic needs, use the phone, laundry, have a shower, enjoy a meal. We're doing that work as best we can at the door. So people can come and access food at the door sort of the way they would through our meal service. We are doing camper deliveries to people who cannot make it out to our door, so that are located in the neighborhood or around the city. And we have an outreach van that goes out to folks who are out on the street to deliver food. But it's not just food. We also provide hygiene kits and harm reduction kits. We are now providing winter gear. And so we're trying to do that as much as we can outside of the center. When the pandemic first hit, we were allowing women to come in maximum of 3 at a time, which is such a drastic reduction to the service or like the capacity that we'd normally be able to provide. And now with the Code Red restrictions in place, it's really one person at a time to access, you know, the washroom, and that's it. So it's a really, really tough decision that we had to make as an organization to, you know, keep our staff and participants safe, because all those needs are still there and probably more than ever right now. We are still meeting one-on-one with women and families for really emergency situations around housing or homelessness or safety related to gender-based violence. But we're certainly not meeting the need for that right now. And we have had some funding throughout the course of the pandemic, and it was just renewed to offer hotel stays for women experiencing homelessness or gender-based violence and needing to be in a safer space. And that's been super helpful. So, I mean, you give community organizations the budgets to provide these kinds of things, and they're going to be really great at finding innovative ways of meeting the needs even during a pandemic, and we'll do that. But the problem is, like, it's not really addressing the issues, right? And so we're also trying to think, while we do this and figure out how to meet these immediate needs during the pandemic, how do we do our transformative work differently, or can we do that differently right now? And so at the Right to Housing tables and Make Poverty History Manitoba tables, you know, how we're talking about how this public health crisis, I think, has really highlighted the importance of having a home, for example, right? Like, everybody's being told to stay home. If you don't have one, what does that mean? And how that puts us all at risk. And so thinking about how we can re-message really things that we've been saying for years and years and years that need to change to meet these needs, how to re-message them in a way that maybe will resonate more so with people, given what people are thinking about and how they're feeling during the pandemic. So with Make Poverty History, you know, we often talk about inadequate employment and income assistance rates. Megan mentioned a lot of the supports that have been offered during the pandemic. Some of them have really helped low-income people, but a lot has been targeted at, you know, like working poor. And so most of the women that we are connecting with regularly, they are not working and receiving EIA, and they've really received no support, no additional support during the pandemic. And, you know, some folks on EIA applied for CERB. Somebody, I think, mentioned something about that in the chat, you know, really out of desperation for income, because, you know, the rates are so low. They always have been. That hasn't changed. And like everybody else during the pandemic, people on EIA are struggling, right? Like, they're struggling financially and to meet their household needs. And so people applied for CERB, and as a result have had their EIA benefits off or closed. And I know we've been talking with EIA to figure this out, and they're really working hard to sort of get people back on to EIA. But there's still a window there where people are going without any income at all. It means they're potential evictions. Anyway, so there's, you know, we've been doing advocacy around, look, let's just not close people's EIA files during the pandemic. You know, there's all kinds of reasons why benefits get held if you don't go to your addictions treatment program, or, you know, there's a whole variety of reasons why that happens in normal times, for better or worse. But how about during the pandemic, we don't let people have no income at all. We don't punish people on EIA for not meeting certain requirements, to make sure that they don't lose their housing and become homeless, and to make sure they can have some source of income to at least try to meet their basic needs. So that's something we've been advocating for. There was also the eviction ban that was put in place. That's been lifted somehow as the numbers have really surged here in Manitoba. And so that's another piece. And I think with right to housing, that just that overall advocacy around, we need to be investing more so in our affordable housing in Manitoba, has given us, you know, the pandemic given us that opportunity to say, like, look, we know housing is important. We can really see how important it is right now. And so this is not the time to be selling our public housing, which our provincial government is doing. We need to be investing in it more. So I think that transformative work is just being messaged in a bit of a different way right now because of the pandemic.
Yeah. Okay, great. And Kirsten, thanks so much for kind of bridging these two pieces of the panel, because the last question is really about getting into that more transformative space of change. So I definitely want to start with you in the next panel, and then hear from everybody about creating lasting change. But first, we want to share the results of the poll. I'm not sure if it can be pulled. Oh, it can be. Okay, great. Great. So the answer to the question about the new percentage of food insecure households, as reported by Proof, is C. It's 14.6%, which is just it's an absolutely devastating statistic. And I want to just amplify some of the work of Valerie Tarashuk from Proof on this, who was on The Current last week talking about this issue, and how that this measure, while it's an indicator of an increasing trend, it doesn't really capture the extent to which this is quite devastating. So these are measures of high levels of food insecurity. They're not necessarily capturing, you know, what other lived experiences are people who are included under this metric living with, that, you know, with the panelists today, we're talking about issues around housing, all different kinds of sort of multi-dimensional factors that are influencing people's lives. So I do want to get right into the last question that we have, and then we have some time for Q&A. And I see the sun is coming out in a beautiful way too. That's great. So the last question, and I'd love to start with Kirsten on this. What are the most important things to do going forward if we want to create lasting change? You talked a little bit about coalitions. You've talked about some of the policy advocacy. And so just digging deeper into that a little bit, what are some of the things that you see we need to do?
Yeah, so yeah, like I said, I really think that this is sort of, the pandemic has highlighted these ongoing systemic issues. Like, we know the income assistance programs have long been inadequate. Our governments have never invested enough in providing affordable housing options. And like, it's a growing burden that has been increasingly placed on nonprofit organizations and, you know, this charitable sector to fill in these gaps that our governments have left. You know, like, West Central Women's Resource Center should not exist to provide for people's basic needs. You know, like the ACU ad at the beginning that showed all the amazing stuff that's happening there to support that work in the community. Like, we need to be providing these things right now, but we shouldn't be depending on that way of meeting people's needs for food and other basic needs, right? So I think now more than ever, we're seeing the flaws in this approach of this charitable approach, the flaws of not having a social safety net that provides people who need it with a basic income and an affordable home. You know, like Megan was pointing out, the drastic reduction in donations during the pandemic, and relying, you know, on a charitable model where we need government funding and donations to provide people with food. Like, that's never really worked well enough to meet the need that's out there, right? And now, though, that sort of last line of defense that these community organizations are providing is not like able to do what it once was able to do. We have to drastically limit our services for safety reasons. And as a result, like, the most vulnerable people are being left in crisis. You know, we have grocery stores that remain open to us for people who can go out and buy their food that way. But our government income assistance, people who receive that, don't receive enough to be able to go and purchase food from the grocery store like we do. So where are they going in times like this? And so, I don't know, in terms of like what we can be doing going forward, I think we need to keep talking about that, so that, like what the real issues are, that that charitable approach is not enough, and that we need, like what are these real solutions? And it looks like economic security. And how do we provide that? How do we create a labor market that provides sufficient wages for people to be able to meet these needs? How do we have a childcare, like a public childcare program that allows caregivers to go out and work and have somebody look after their children while they do that? How do we have an income support program that allows people to actually, meet their needs, not be living in a constant state of crisis, and be able to actually go out and take steps towards, becoming more financially independent if they're able to do that. So in the coalition work we're doing, I think partly because of COVID, but also just realizing, like, in this current political environment provincially, our usual work of, meeting with government officials and, putting out op-eds and the occasional rally at the Ledge, which we certainly can't be doing right now, is not working. The provincial government's really moved in opposite directions around our housing public policy, and they're not really budgeting on income assistance rates. And so we're thinking we need to start going out into community as much as possible and connecting with people who live in Manitoba so that they better understand these issues and what the real solutions are, and that they're more informed, and hopefully to a point where they're willing to take action around it and put that sort of public pressure on our political officials to make these changes, because it doesn't seem like that's happening without the public pressure. So I think we need to be trying to find more creative ways of connecting with people around these issues. Like the one woman in the video talked about people helping to address food security by going to, a soup kitchen, I think she said, to break the stigma. And when I first heard that, I was like, well, that, just going to volunteer to soup kitchen, that's sort of perpetuating the charitable approach. But it's not if you're doing that kind of volunteer work in a way where you can connect with people who are experiencing some of these issues that we're talking about, and you build relationship there, and you build understanding as to how it is that people are in the circumstances they're in. So I think if we can find more ways to connect people who donate to organizations like ours and to Winnipeg Harvest, to actually, or who volunteer at places like that, to find more ways to have them connect with people who are different from them, who are experiencing these issues. Like Right to Housing started, right before the pandemic hit, doing presentations in churches to connect with people from faith communities, to talk to them about housing and like what the public policy solutions are to homelessness. We talked about Giving Tuesday this week, like maybe instead of giving, you donate your money or some kind of item, what you do on Giving Tuesday is call your MLA and tell them you're willing to pay, your share of taxes to increase EIA rates for people, right? And so creating more options for people, I think, to become informed about what the real issue is. And we're talking about food security. It's not about food, it's about economic security, and then finding ways to support people to take action around that, I think, is where we need to go.
That's excellent. Great. So I think I'll put it over to Megan next, because I do think there are some sort of parallels with the, working under more of a charitable approach. But at 12:20, we do have to start thinking about wrapping up, and we also have some questions from the audience. So if you can just keep it to a couple of minutes, although, I wish it could go on for longer. Sure, a lot of
Yeah, I feel like I can't even say more. Kirsten just nailed it all. That's fantastic. We share responsibilities on the steering committee of Make Poverty History Manitoba, so I would have said the same things. I fully agree in terms of the conversation around the charity model and things that we can do to sort of change how we do things. I hope I conveyed some of that in my previous comments around how we aren't meeting the needs, although we're certainly trying. We definitely know that there's gaps as an organization. And we're making a lot of assumptions with what we provide to the community, assuming that they have food or income to be able to supplement. So one of the things that, yeah, again, I'll just amplify again, like connecting with our community, I think is super important, especially with people being isolated right now, and just knowing that COVID exacerbated inequalities. So finding ways to limit those barriers so that people can be a part of this conversation is extremely important. We've been asking our new clients, so clients have never accessed our services before, why they are now. And it comes right back to what we said we've been hearing for 35 years, and it's all been around not being able to make ends meet and employment. So, you know, just further saying that we think it's important to commit to income support, commit to permanent income support so that no one's left behind. I'm just looking through my notes really quick to see if there's something else I can add. But certainly understanding that it's not, we also need more than just revamped income programs to ensure that people have their needs met, and that certainly looking at a more holistic, community-centered approach is needed as well. So focusing on food, but also housing, I should say, medical needs, childcare, and all of that needs to be invested in grained in social policy. I was going to talk about just sort of like very immediate responses, and Michael put it in the chat around the Make Poverty History Manitoba open letter. And then again, and I believe, hopefully Michael will speak a little bit about this in the next session, but just around like Make Poverty History Manitoba's campaign for a livable basic needs benefit. So, you know, and a campaign right now that brings the EIA basic needs benefit up to 75% of market basket measure is a campaign that we're advocating for. And there's been a bit of conversation around basic income. So, you know, certainly from a board member of Basic Income Manitoba, we advocate for basic income. Also, there's other terminology out there like a minimum income floor. So just making sure that when we advocate for those types of interventions or programs, that they need to be universal, unconditional, and that they can't leave folks further behind. So kind of again, talking to the livable basic needs benefit and making sure that it meets a criteria that's livable. And that just further, you know, explaining to people maybe that the benefits of these programs or these interventions are that they're not stigmatizing, they're empowering, they're dependable, and they support precarious work. Things have changed. Our labor force has changed. People are finding employment in different ways, and it's not always consistent. And so we need something that people can depend on when they need it. I'll maybe leave it there because I imagine that there's more comments. There'll probably be some comments. So thank you.
Yeah, for sure. And I think some of those issues will probably come up in the question round too, which is great, but excellent response to that. So Damien, is there anything that hasn't already been mentioned in terms of ways to create long-lasting change that you wanted to add in just a couple of minutes?
Yeah, definitely. I think, you know, to create some long-lasting change, especially in Indigenous communities, northern or not, is we need to ask ourselves some important questions as Canadians. And part of that is, you know, do we want to be part of a Canada that is more an empire where prosperity is built through the betrayal and destruction and exploitation of the Indigenous nations that we share this country with? Or do we want to honor the roles that have brought us to this place of prosperity and the relationships? And do we want to build real investments to offer equal the playing field of where this prosperity reaches? You know, to honor that very strong relationship that has helped Canadians feel the the beautiful standards of living that they have today. And one important part of that is, you know, to empower our people to take that you know, metaphorically, that boot off of our necks that has held us down for so long, and empower us to heal our own communities. Because one thing that happens when you try to solve a problem that you're not intimately familiar with, when you don't understand that problem, your actions can have, you know, even much greater, worse impacts. So it's about building that relationship with our people, with our communities, and trusting that we are capable, that we can fix our own problems with a little bit of help and with that support. And I guess that would be the main thing, given the time constraints that we're facing here. Thank you.
That's a great and very far-reaching answer, Damien. So thank you so much. The chat during this session really blew up, and there's a lot of comments and questions. So I'm just looking through all of mine now. Okay, there are a few questions about EIA. And so I wanted to start with those. They're kind of based on the first discussion that we had, just to share some answers. So there was a question from Joanna Platter. EIA rates should be increased annually tied to inflation rate. Does any jurisdiction do that? And then a related question from Hannah Derry. How does Manitoba's EIA rate actually compare to other provinces? And I'll just open it up to the floor of whoever's our EIA expert here.
I don't have the answers, I'll be honest, but Maytree just released a report about all of Canada's welfare state, and so it would be on there. I don't know if someone can throw that up in the chat for me, but there is in that report, and I feel like I should have dug deeper in it, but it does talk about it, and it does do an analysis of where everybody sits. When was it the last increase? Whether they decreased. So checking that out would be a good resource.
I'll add to that too, because I don't know the exact answer, but so rent assist in Manitoba is actually tied to something. It's not inflation. So it's the median market rent, I think. And so the idea when they created like that shelter, there's always been a shelter portion of the EIA budget. And obviously it was not indexed to anything in the past. So it was $285 up until Advocacy from Make Poverty History Manitoba and Right to Housing. That led to the creation of the rent assist benefit, which sort of replaced that $285. And so rent assist, which is that 576 amount that I referred to earlier, that is supposed to increase every year to keep up with median market rents. However, the current government provincially did make some changes in there in the past couple of years. So now there are certain categories of people who receive EIA that do not get that increase anymore. So unfortunately for them, every year as rents continue to rise, their ability to meet their housing needs is beginning to become even more challenging. The other piece of the EIA budget, that $195 you get for everything else, not tied to any sort of inflation or increase. So it won't change from year to year unless we do something about it.
All right, so I have another question and sort of a comment that I wanted to highlight from Shelley Bevs. Shelley says, and this is more related to what Damien was presenting about, she says, I can absolutely relate to Damien being First Nations and the challenges as our culture is tied to the land and water from my home Indian band. How do we empower all people to live out of crisis, as that is all many of us have known? How do we harvest from the land? These lessons were taught to us by our elders. Damien, did you want to answer that question?
Yeah, for sure. Like she mentioned there, these were taught to us by our elders, and that's exactly where we have to go. We have to find good teachers and be ready to commit to everything that it takes to learn that information, that knowledge, that wisdom that has allowed us to thrive for thousands of years. It's not an easy process. You have to really prioritize it and commit to years of learning and going out on the land and learning what the real laws that govern our nations were, the responsibilities. For example, I always hear people talk about, how we need strength when to heal our communities. And from going to the elders and ceremonies, we start to learn that more so what we need is kindness and caring and sharing and truth. And those four gifts will give us everything that we need when they're fully understood, to heal our communities, to come out of crisis, to help each other. So it's a long journey, but it starts by reconnecting to our culture, to our ways, to our elders, to our youth, to
All right. Thank you so much for that answer. And Damien is still here, maybe not. Yeah, I think so. It's 12:20 now. There was a comment from Marianne Cirilli about combining advocacy and outreach. So I think that's being the theme of this panel. I was wondering if we could maybe close the discussion on that note. So what would a model of combining those two things look like as we move out of, or we're still very much moving through the pandemic right now, but what does that model look like to either of you, Kirsten or Megan?
So I can start. I think when she says outreach, is she meaning, I did try to follow through the comments about like connecting with people who are experiencing the issues that we're advocating around to do the advocacy as well, I think.
Yeah, I mean, I see it as kind of like, how do we combine that like service delivery or outreach with advocacy, that maybe that immediate work versus the longer term transformational work?
Okay, so that's a bit different. I thought she was talking about because I read something about tenant advocacy. I mean, yeah, I think that like we're doing a great job of managing both, like doing both, right? Because there is a capacity issue, I think, in all of the work that we're doing out in the community, right? And issues around burnout and all of that. So like a lot of the coalition work that's happening, it's not really happening through any like paid positions, right? It's people like myself and Megan and Michael and many others that are here that, they are paid to do their job, but as part of their job, at West Central Women's Resource Center, for example, I can put time into the work that Right to Housing is doing and that Make Poverty History Manitoba is doing. But we don't have the budgets, and nor do we necessarily want to be, dependent on funding as a coalition to do that work, depending on where the funding is coming from, right? If it's coming from government. So we do see that capacity issue that frontline organizations have to do service delivery happen at the coalition level as well. And so there is, a lot of the same folks that do have that capacity within their day-to-day job to put into the advocacy work that are always doing that work. And so maybe a little plug for the coalitions that if there are folks on this, Zoom call right now that are interested in getting involved in more of the advocacy work, get in touch, because we do need more support and capacity to do that.
Great, thanks. Damien, so happy to see you back. You made it, you were out for a second, and I know my internet went up and down for a second too. So we're just wrapping up with a question about pairing sort of outreach and advocacy work and what that model would look like. So Megan, I don't know if you want to answer first, just as sort of a last interjection with this discussion here.
Yeah, I found the question. And so, I think like Kirsten was saying, we do a lot of it now, and we could do better in terms of, I'm speaking from an organizational perspective at ensuring that all voices are a part of that conversation. There was also a question in there that a while ago that popped up that asked about our vision for an alternative to charity. And in the video, somebody said community grown, community owned. And I feel like I want to shout that. Like I really feel a lot of passion towards that. And it's something certainly from an advocacy role I hold dear. I really want that to be a part of all that we do at Make Poverty History, Basking Manitoba. And so ensuring those voices are part of it. So just speaking to organizing tenants or people that use food banks or hydro increases, like spent so much time, and is prior to me in my years of time at Harvest, but we had we created these relationships with people that helped us do that. So I think of like Public Interest Law Center, who helps us bring the voices of lived experience to the conversation about hydro increases. Sometimes it's hard for us to explain that, or like, why am I advocating for cheaper cell phone prices, right? But the reality is we ask people to phone, to be able to access our food bank. Or make their appointments. So there's all these ways, and I just hope, I want the community to know, unless folks probably already do that, we do our best to do that, but making sure that that's at the forefront. So when you're creating a committee or creating a policy or like, I don't know why rules of engagement come to mind. That's not what I was thinking of, but making sure that that's a part of it. So ensuring that there's somebody on your board or your committee that lives and breathes these things that you're advocating for, and ensuring that their time is taken care of. Like as Kirsten said, I'm here because I'm being paid from a job, but if we're asking someone to volunteer their time, perhaps an honorarium or something that can support them, because time, you can't get that back, so I think we need to be able to recognize that. So.
Absolutely. Yeah. And Damien, did you want to share a last statement maybe about this alternative vision of charity or pairing outreach with advocacy, or your final thoughts on that?
I'm not really too sure what to say on that. But I did notice one question that is, for me, that is now gone. My computer died. I had it plugged in, but I didn't have the light switch that turns on that outlet switched on, and I don't see it now. But it was something about like asking how Canadians can, I think the term they used was settlers and newcomers, help to walk in a good way with us. And I think, okay, I'm seeing it here. The question, how do we walk towards reconciliation and be part of self-determination of Indigenous communities? I think, the best way to do it is to understand where we sit in this relationship, and understand what the potential effect is that we can have. I mentioned how trying to come in and as many people have done in the past with the best intentions, and to come into our communities and to act as, saviors to a problem that they don't understand, only causes more problems. And it's just not an efficient and not a wise way of approaching things. So I think a big part is understanding where exactly we all fit into this situation, and what, given that aspect, what we can really hope to achieve. And a lot of that from the, I'll use the word settler point of this relationship, would really to be understanding of how their society holds back First Nations societies and communities, and to understand deeply the laws, the regulations, the policies that they benefit from, that are really harmful to us our First Nation communities, and to push the governments to lift restrictions, to fight for more inclusiveness and equality, and things like that. That could be a start.
Absolutely. Thank you so much for, all of the incredibly generous answers that you've given today. So we just have a few notes to wrap up on. This discussion was so wonderfully substantive, and I think we really got to the root of some issues around this new vision for charity. So thank you so much to all of our speakers today, also to CCEDNet for hosting this panel, and thank you to the audience for being so engaged, and for sending so many things in the chat and all your thoughts. It really felt like we were more in person than on Zoom. So if you don't already follow us at Food Matters Manitoba, please do. And just to wrap up, we do want to gather some feedback from you before we let you go. So there's a couple of questions here. One is, do you feel you know more about food security than you did before? And number two, did you find this format useful for learning? So it was kind of more of an interactive panel, focused more on discussion questions. What did you think? I'll just give you a second to answer that. And yeah, thank you again, everybody. This was really wonderful.
Thank you so much, folks. Thank you, Beth, for hosting and keeping track of that many different presenters and of questions. I know that hosting role is challenging. Thank you, Damien, for your incredible perspective. Megan and Kirsten, friends and colleagues from my work for a long time. So good to have you here today. And just as I close out, I'll encourage folks to stay on for a second if you can for a couple of announcements and then some musical entertainment. I think we're keeping the poll up maybe for a second as well. I can't see it while I'm speaking, but so I wanted to grab a couple of things that really stuck out to me. You did such a good job of making system links between housing, income supports, and colonization, and then food. Like we were talking about food security, but got into all those other things. I think you did such a great job of really illustrating how that stuff's deeply connected. And I think both our next session and our Friday morning session and final plenary might be of real interest to folks. We talked a lot about how do we combine advocacy and systems change and bigger transformational change with that frontline work that's so important to meet people's basic needs. And I think our next session about policy advocacy, our morning session on Friday about digital organizing, and our final plenary that's going to reflect on how do we keep weaving movements together. I think those will all be moments to come back to that piece of conversation. So I think Tanya's our brilliant ASL interpreter. She probably will be laughing that I'm saying who she is while she signs about it. But I think what I've learned is that this is applause in sign language. And so I just wanted to give that shout out to our panelists. Thank you so much. And our shout out to Tanya for keeping up with these panels. So everyone stick around. We have an incredible musical interlude to kind of play us out. And before we get to that, just a reminder that if you haven't already filled it out, you got a pre-conference survey. Not only does it give us some important information, most importantly, you add your name and address and you get to get a gift from us following the conference. So make sure you fill that out if you haven't. Also, you'll get a final evaluation survey at the end that's going to really help us know, can we keep doing it this way? Should we do it this way? How did this work? What was it like compared to the real life gathering? That's important to us. If you're on social media, use hashtag GATH2020, G-A-T-H 2020, to post photos and thoughts and quotes that you might have captured from these sessions. And after Madeline, we'll put you in the waiting room and we'll come back for Policy and Advocacy 101. But now I'm gonna bring Madeline back. She's on the screen. If you didn't see her this morning, Madeline is a singer-songwriter from here in Winnipeg. I don't know if I'm allowed to do this, but I'm going to anyway. She's also the daughter of a dear friend of mine and a member of our network, Marguerite Roger. Also a friend to a number of our staff. So I think I said this yesterday, that as a network, we get to draw in a lot of cool people just because we know everyone. When you're in a network, you know everybody somehow. So Madeline, we're so happy to have you here. You can go to the website under the program information. You can find bios for all our musicians, including Madeline, and take it away. It's so great to have you.
Great, thanks so much. Yeah, I have to say, this has just been so unbelievably inspiring. Again, I know I said that earlier, but I'm just amazed at the work that's being done, and it's so heartening to see all of the forward momentum through such a hard time, on top of all of the other difficulties that are already being faced by people in our communities. So yeah, thanks. It feels hard to follow. But I'm going to play a song that I wrote about growing up in, I grew up in Charleswood, right on the edge of the city, and really witnessed the slow and fast development in ways that I couldn't understand, watching wild spaces that I loved just being paved over for financial gain. And yeah. It's called Brick on Stone. Ooh, 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 ooh. I was born at the edge of town. I'm not a city girl. I'm not a country girl, there were tadpoles and poplar groves. The prairie sun sank low. Mother planted corn and mint, father picked the lilac, and down the road the city unfolded, skyrise overhead, the billboard promising you can have anything. I'm a girl from in between, brick on stone, on soil, on seed. We're building everything wider. Ooh, ooh, ooh. Once raven in the old oak tree, Saskatoon's beside her now. The telephone pole, the substitute, the chewing gum, her daily fruit. We've built this city wider. Brick on stone, on soil, on sea. We're building everything wider. Ooh, ooh, ooh. The woods across the street from where I grew, they're tearing it down, concrete load for another road, and a 3-door garage in every home. Row upon row like catacombs. Can't tell the neighbors apart from strangers. When the lady slipper disappears, when the whiskey jack takes swing, jackrabbit for a jackhammer, and a duck bill for $1 bill. We'll have 300 channels every day. There are no more trees here anyways, and we'll work all day just to pay to forget. Brick on stone, on soil, on seed. We're building everything wider. Ooh, ooh, ooh. Ooh, 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 ooh. What I didn't tell you is that I've never played that one for anyone. We're taking some gambles. Here's one I wrote right after New Year's a couple of years ago. We made it through another December. Take your coat off, shopping mall Santa, and where'd you think you're going with all that wine? We'll make a resolution another time. I wanna remember kissing you with the light of the moon, pouring through that old piano out of tune, and those 3 words I said to you. Ooh, you got a whole lot of heart. You got a whole lot of heart. I'm sitting in the kitchen with the radio on, hearing all the names of folks now gone, and honey's on a plane to Amsterdam, singing a song in an electric can. And I wanna remember getting through all the shit that the world had to do, like White House keys to you-know-who, a tangerine without a clue. Ooh, you got a whole lot of heart. You got a whole lot of heart. You got a whole lot of heart. Remind me of what year we're living in until at least September. And here's one that I wrote on the train. There's this really amazing program that Via Rail does called Artists on Board, where they allow musical artists to have free passage and meals anywhere across Canada in exchange for a couple sets of music every day in the they're called the entertainment cars. And yeah, so I wrote this song on the train when I was doing this program from Winnipeg to Toronto and back. From the train, you know, I see little crystals on the water, little pictures on the water. A wooden boat, a corduroy coat, a root beer float for me. Little pictures I can see. Wouldn't come this way for me. You don't see these things like me. You see only waves on the water. Ooh, ooh, ooh. Out your window I can see silver tinsel in the pine tree, silver lining in the pine tree. A roof in rain, a lion's mane, a memory lane for me. Silver lining I can see. You wouldn't come this way for me. You don't see these things like me. You see only needles in the pine tree. Ooh, ooh, ooh. In the sky, you know, I see those stars look down on me. Those stars shine bright for me. The sun will melt Orion's belt, good luck dealt for me. Those stars shine bright for me. You wouldn't come this way for me. You don't see these things like me. You see only clouds in the sky. Ooh, you wouldn't come this way for me, and you don't see these things like me. You see only waves. You see only needles. You see only clouds on the water. Ooh, ooh, Thanks so much. And yeah, see you soon.
Thank you so much, Madeline. That was so beautiful. We have a little group chat for our staff that's separate from this so we can keep track of things. And it's just mostly been, oh my God, we love this song. Oh my God, we love this song. So thank you kindly.
Well, thank you.